of life after SICS and phacoemulsification, Dr. Nidhi Pandey. Dr. Nidhi Pandey. Your membership number, ma'am? Speak to the mic. Yes.
P07183. Hello everybody, a very good afternoon to all of you. I'll be presenting my study on the quality of life after SICS and phacoemulsification. I have no financial disclosures in this study. Manual small incision cataract surgery, or SICS, has proved to be a safe and cost-effective technique for tackling the huge backlog of cataract blindness. And it has been shown to be as effective as phacoemulsification in terms of visual outcomes and safety of the procedure. It might even be superior to phaco in tackling the hard brown cataracts in terms of the surgical time required and its cost effectiveness. The complication rates are comparable with those of phacoemulsification. To evaluate the outcome of any intervention, visual acuity alone might be an inadequate measure, and the assessment of patient satisfaction and quality of life following intervention are also important. This study compares the change in quality of life after the two surgical procedures using the Indian Vision Function Questionnaire. This questionnaire has been developed by Murthy et al. To elicit the problem statements describing the consequences of vision impairment in the Indian population, and it has been devised in de novo from patient opinions and experiences following recommended steps of instrument development, and has been previously validated and tested for reliability. The study was a quasi-experimental study conducted in the Department of Ophthalmology, Pandit JNM Medical College, Raipur. We recruited 60 patients from February 2017 to April 2017. We included patients aged 20 to 70 years who had a nuclear sclerosis grade 2 to nuclear sclerosis grade 4 cataracts in both eyes, who presented to us for cataract surgery. We excluded those patients who had vision-threatening other ocular comorbidities and those having chronic systemic diseases that could significantly affect their quality of life, and of course those patients who were not willing to be interviewed. 30 of these patients underwent SICS and 30 underwent phacoemulsification. The assessment was done using the Hindi version of the questionnaire, which has been previously used by the developers by translating and back translating. This questionnaire has 33 items in 3 domains. Domain 1, 2, 3 having the general functioning questions, questions related to psychosocial impact, and visual symptom related questions. The responses were calibrated quantitatively by giving a score to each of the responses from 1 to 5 for domain 1 and 1 to 4 for domain 2 and 3. The summary scores from each domain were added to give a total quality of life score with a minimum score of 33 and a maximum of 153. So the higher was the score, the worse was the quality of life. The questionnaire was administered before surgery after taking a consent, and then the participants underwent either SICS with implantation of a rigid PMMA lens or phaco with implantation of a foldable lens. All surgeries were performed under peribulbar anesthesia. Quality of life was reassessed at approximately 15 days to 1 month after surgery by the same assessor, and this was done before spectacle prescription because we believe that for everyday ambulatory vision, most patients do not use their spectacles and rely on their uncorrected vision. The age group of the patients in the SICS group was slightly higher compared to the phaco group, and there were more females in the SICS group, while in the phaco group there were almost equal distribution of males and females. Then we tested our data for normality using the Shapiro-Wilk test and found that it was not significant for both the groups, indicating a normal distribution of data. We then did a pre to post-operative analysis for the SICS group and found that the quality of life scores in each domain as well as the combined total score demonstrated a statistically significant decrease from pre to post surgery in the SICS group. Similarly, in the phaco group, there was a statistically significant decrease from pre to post procedure for all the 3 domains as well as for the total score. Then we studied the difference between the 2 groups in the change in scores using the independent samples test and found that there was no statistically significant difference between the groups in any of the domains nor in the total score. Previous studies have shown significant improvement in quality of life after cataract surgery. Better outcomes in terms of patients' quality of life following phaco has also been compared to manual extracapsular cataract extraction. This study is the first of its kind comparing quality of life following phacoemulsification and SICS. Quality of life scores decreased significantly following both interventions. No difference was found in the pre to post change scores between phaco and SICS groups in any of the domains nor in the total score. Both intervention techniques could thus significantly improve the quality of life, with no one technique better than the other in their ability to affect the quality of life scores. For future research, we suggest comparing the quality of life scores on a longer term basis or even on a shorter term basis using a larger sample size. To conclude, both phacoemulsification and SICS significantly improved the quality of life post-operatively to a similar extent, and as with other previous comparisons, SICS proved to be equivalent to phacoemulsification in terms of improving the quality of life also. Thank you.
Thank you, ma'am. Your study group is too small, 30 SICS and 30 phaco. We are doing hundreds of SICS and hundreds of phaco. And
yes, sir.
how come you can be so authentic with 30 patients
yes,
in each group?
Actually, we designed this study as a pilot study and we'll be using this data to carry out a larger study, sir.
Dr. Nidhi, first thing is that what stimulated you to do this type of study? Means comparing the two procedures.
Yes,
and
actually.
And the major confounder, my question, major confounder, that is study population, have you taken care of that? That what type of population was there in SICS and what type of population was there in phacoemulsification?
Yes, sir. It was like I told, in the age group was slightly higher in the SICS group, but we included those patients having nuclear sclerosis grade 2 to grade 4 in both the groups.
No, that's not the question. Question is, means those who can afford it and those who can't afford it.
So we are in
entirely different population and group between the two.
So we are in a government setup, and both the surgeries are entirely free of cost.
Sir is also in government setup, but what he is talking is holds a key to his observation. Anyway, thank you, ma'am. Dr. Shisht.
The VFQ score according to age, probably they could have given us some very, very important findings, because higher the age group, probably the quality of life. And second important issue which I have worked on quality of life studies, it depends on the patient. I have observed patient with 6/60 vision, they say they are happy with the quality. And people with 6/6 vision outcome, they may not be happy with the quality. If we can add on the outcomes after cataract surgery, what is the visual outcomes, probably that could have given much better information.
Actually, SICS has been widely compared with phaco in all other terms, but we found this comparison has never been done.